Hi, early bird. We are being recorded.
Hi, Ivy. How are you?
I'm okay. Why are we being recorded?
It's the conference.
It's just on auto record, huh?
I think it is. It was recording when I came on and I was the first one.
How are things with you?
A little hectic, but good. A little hectic, but good. How about you?
Just busy.
Yeah.
Just nonstop busy.
Non-stop busy is the name of the game, I think.
Sophie is waving to you guys.
Hi, Sophie.
Hi.
Here, do cameras. Where are you?
Hi, Sophie. How are you? Are you good?
She's
Yes.
making
Got a big
faces.
smile on your face.
That's Pat.
Yes.
And I know some of you also worked on your own CoIIN projects, and perhaps some of you worked on teams with these CoIIN projects. No, I know that at least one of you did. So I don't know also if you were part of one of the teams, also welcome to share kind of your reflections after seeing this kind of synopsis of your work together.
Sebra, I'd like to answer. Ivy had asked about our parent surveys in our brag box, and do we have additional questions? We were able to ask questions that were basically pertinent to the telehealth visits and how they were accomplished, and did they feel that they were able to get out of it what they wanted to, that they received quality care. And so it was really fascinating to, again, appreciate how parents perceived the telehealth visits. And it was so much better than what I would have thought it would have been, which I think is fantastic. And again, we've heard the stories of parents that had, parents had felt that maybe people didn't want to look in their homes and they felt uncomfortable. We did not experience that at all. And it was very eye-opening for the providers to be able to see the circumstances, that children are in. And, I alluded to in the presentation, and I go back to it, the best was the mom that said, I really felt I could connect with my provider, with the physician that was doing the visit. Because again, there wasn't any parent, especially a parent with a child with special needs, that are, trying to get everybody in the room and keep everybody calm and collected. And it's just very onerous. And that was not necessary. So that being in your own home allows you that flexibility to just have that peace, which I think is so important for a really good, healthy, robust visit. So I guess we could put that in our brag box. How's that, Ivy?
Okay.
Great.
Love
Thanks.
it.
And
Thank you.
I saw that we have a question from Jean. And I don't know, Jean, do you want to come off mute and say it out loud? And if not, I can read it for you.
Can you hear me?
Yes.
Oh, I love it when my microphone works. Yeah, I've been thinking a lot about measurement and how we involve families in determining what's important. And I heard that referenced in the talk, and I'm just wondering how you involved families in that conversation, and if you've seen any outcomes from that yet. I know it's early. That's all.
Would you like me to take a crack at that from sort of the 50,000 foot BU leadership level? And then I'd like to invite Pat and Ivy to jump in with the state team perspective. So this is a really great question, Jean. And it's a twofold question that is inextricably linked. There were a variety of different ways that we collected data in the Children with Medical Complexity CoIIN project. Two of the primary ways that we collected data specifically from families was through a family survey, a written quantitative data survey. And then the other was through qualitative data collection through family focus groups. Families were members of the measurement development team when we were putting together the quantitative survey. And one of the things that we heard from them loud and clear, almost from the get-go, was this is great. You're going to get some really good data on progress that the state teams are making on the individual goals and objectives that HRSA has set out for us to base our improvement work on. But you're not going to know everything that you need to know because you're not going to know the story behind the data. You're not going to actually be able to create meaning out of this data unless you've heard that story directly from families. And so that's why in our original proposal, we had the quantitative data collection, which we did, and which we designed with family participants, family leaders participating in that measurement work group. But we also developed an interview guide for family focus groups. And we did at least 2 family focus groups in each of the 10 states over the period of data collection. And out of the 20 some odd people who were members of the family focus work group, about 19 of them were family leaders. So there was an overwhelming majority on that family focus work group who were actual family leaders who were engaged not only in the work of their state teams on a leadership level, but who were also parenting kids with medical complexity themselves. So I think that that's one way that we feel some degree of confidence that we both involved families in determining the outcome measures. And it's also how we feel that we have some confidence in knowing that we made a difference in the lives of kids and families, because when we see changes in that data, we have at least some evidence that we're actually measuring what matters to kids and families because we listened to them from the beginning. So I'm going to take a pause here and see if any of my colleagues have anything that they want to add to that. And I'm especially interested in Pat and Ivy, if you wanted to share anything from the state team level. Thanks.
The only thing I'll add is that we actually, because of that focus group and having all that information, one, we fed it back to the teams, but it allowed us to see that our family survey, we have an unmet need question on the family survey. And it was showing up as if there was not much unmet need from the beginning, baseline, that we were doing a fantastic job and everyone was happy and families did not have needs. But when you look at the focus group and every single focus group, it was very clear that was just not, there was a huge disconnect. So it allowed us to think of that differently. And that's just one concrete example of how we were able to bring those together. And I want to hand it over to everyone, to Pat and Ivy, to be able to share because they have some great things.
Pat, did you have anything you want to say? And
No, go ahead, Ivy. I can go after you.
okay. So our family leader helped was part of the family work group that helped develop the questions that Meg described. And I mentioned that we had a family work group that didn't exist before the CoIIN project, that was built right from the beginning and became the anchor for our project. They were central. And so as the national work group on the survey development did their work, it went back and these things were communicated and they had input in what our family leader would go back and bring nationally. But it opened a discussion, and the families in the family work group were all served by our comprehensive care clinic. And they talked about wanting their child to go to school 3 days a week, or just have a family day at the beach, things like that. And so really independently, they went and started digging inside and searching what questions could supplement in addition to the survey questions all the families participating in the CoIIN would have an opportunity to respond to. some others, and they came up with about 7. And as I mentioned, currently they're being piloted. So they aren't final. I don't know that they'll ever be final, right? We need to continually get input from families. So that was Texas's experience, our Texas team, how they engaged the families to help develop the questions.
So Jean, I think that's a great question. And so when we started thinking about having the telehealth visits, we really wanted to look at how we could, again, overcome any barriers and identify them. And as the news was picking up on telehealth, and parents were saying, as I alluded to previously, parents were saying, oh, this is really working for us. We don't have to travel for an hour and a half to 2 hours to get to the primary care provider. You know, we can have these visits. So as that was occurring, we were seeing it in real time, because we were asking questions of the parents after they had a telehealth visit. And, you know, the questions looked at, again, you know, were you satisfied? And what I'll kind of shore it up is one of the questions that I think gave us the most valuable information was, would you have another telehealth visit? So we, you know, a subtle way, it isn't as if I have a ton of data, reams of data that I could give someone saying, oh, you know, these parents, but we had probably about, and I think I still remember this correctly, but we had probably about a 95, 96% rate of parents saying that they would have another telehealth visit. So, you know, could it have been that the providers were just magical? Could it have been that the nurses and the nursing staff and teaching with the Zoom was magical? Or could it be that we really did meet the needs of our parents and we offered them something that really made their lives easier? And that's what I'm going to go with.
Thanks, Pat. Thanks, Ivy. I see that there are a couple of other family leaders from other state teams on the call today. And if they'd like to jump in with any perspective, I don't want to put them on the spot, but if they wanted to jump in with any perspective, we would love to hear from you.
Okay, this is Sandra. I'll just say that I couldn't resist. I held off as long as I could.
Hi, Lovey.
Hi, sweetie. How are you? I sure missed you. I miss our Tuesdays and Thursday meetings. But the new director is a very nice person, so thanks. So what I just wanted to say that our families really did appreciate us using the telehealth, because it not only saved them time, it saved them money. It saved them children that were having meltdowns because they didn't want to go and do the visits. You know, by leaving them in their home and letting them be in their own environment, it really, I think, gave the parents a chance to relax and actually talk to the doctors. And I think that's very important that they have that type of communication. That's all I wanted to say. Thank you.
Yeah, one of the families in our clinic, I so glad you pointed that out, Sandra. You know, noted, wow, the visit, it came and went. I'd still be packing up to get to the visit if it was in person. It was a tremendous convenience for families.
Thank you. And I just want to note Brandy's comment that my son's neurologist said my son looked like a totally different person, so calm and not agitated. I assume that means virtually as opposed to being in the office. And that is just a wonderful example. And I don't know, Brandy, did you want to share something out loud?
Yeah, I was going to say that the neurologist is the one that we see most often, and he has a hard time with, you know, like getting him in the car and getting him there and that. So the first time he had mentioned that, like, he's not agitating, he wasn't stemming, he, you know, was almost looked kind of like focused. He hadn't really ever seen him that way before, but he has 7 different specialty providers. And I think all of them had the similar comments. And what was actually helpful is he had a couple of pretty big seizures before we were doing an appointment. And normally I would have had to cancel. I would have had to like I can't get him like that. But all I had to do was show him on the screen, he's here with me and we're gonna do this appointment. So we didn't even have to miss that appointment and try to hassle to reschedule or, readjust my work schedule or anything. So like for our family, and for speaking from my family, I mean, I hope telehealth stays forever because it is so much easier for all of us, honestly.
So Brandy, I'm going to take the perspective of a pediatrician and put my pediatrician hat on. And it is so beneficial for us to be able to get an idea of how a child's doing. Parents will come in and say, oh, Dr. Purcell, they did this and this and this. And, the child's just looking at me and I'm thinking, okay, you have to envision, right? Because you are the moderator for your child. It isn't an adult that's sitting on the table that can tell you what's going on. The parent is the conduit. And so having that ability to see the child in their own environment and really have a really earnest discussion, I can tell you from the provider standpoint, it's fantastic. And I'm sure your provider, your neurologist, feel very blessed that they have that opportunity to see him in that environment.
So I'm going to jump in just because we are actually remarkably like 3 minutes away from being at the end of this session, which is sad because we feel like we're just getting going, but I also want to be respectful of people's time because it's been a very long day and many of you have other responsibilities or don't have other responsibilities, but still need to end your day. So I did want to just note that Linda had put a question in, 2 questions in the chat. Were there measurements used to gauge family leaders' involvement in the CoIIN? And do we know if there's going to be a CoIIN 2.0? So I don't know if there's time. Meg is really, really excited about answering that question.
Really excited to answer that question. So thank you, Linda. Those were both great questions. Yes, all of the state teams were required to use the FESAT and required to use the FESAT as baseline, create an action plan for improvement in 1 or 2 domains of their choosing, and then to do the FESAT again so that we could see measurable change. And it was a really, really terrific experience for our teams. We were the first sort of group outside of the pilot testing that Family Voices did to actually put it in the field. And I think we learned a lot from it, which was really wonderful. There is currently a competition out under review. It closed back in March for a similar kind of quality improvement set of projects that would be overseen by a national coordinating center. We don't have any insider information about where we're at in the process of that being under review, but it is with HRSA now. And we're hopeful that an award announcement will come sometime in, it would be an August 1st start, sometime in late June or early July. So fingers crossed, we will keep everyone posted on that. And if you have a good thought to send our way, we'd appreciate it. Thanks. I appreciate the extra time there, Sabra. Thank you.
Yeah, no, thank you all. And again, and we have a special guest joining us, Justin's baby. And that is a delightful and wonderful way to, I feel like that feels like the end of a really great session. So thank you. Yeah. She has an audience. She's a bit of a Zoom shark. And yeah, so thank you all for being here. Please do reach out if you have any questions. If you can go back and look, there were email addresses, contact info for everybody on the last slide of the recording. And I can just plug telehealth@amchip.org gets to me. And it's easy to spell and remember. So if you do have any questions and forget later and want to think about it, please do reach out and we'll make sure that those questions get to our panelists. So thank you all so very much. Have wonderful and peaceful evenings and hug your loved ones. And thank you for being here and we'll see you tomorrow.
Thank you, Sabra. Thank you, Justin. Thank you all. Take care.
Bye. Thank you.
Thanks, everybody.
Thank you,
Great
everyone.
discussion.
Beautiful baby.
I know, I'm like, I'm not hitting the like end meeting for all.
Yeah, I can't yet. It's like cocaine, crack cocaine, watching the baby. Oh, there's a cat.
He came.
And
He's
a
been
kitty.
sitting
Oh, my
in
kitty
the-
cat too. That's great.
Hi.
You know,
Ah.
you guys
Hi, hi.
were a delight, and this was really fun. And you know, the dirty secret is actually switched with somebody right at the last minute, and now I feel kind of guilty because I definitely had more fun. So, yes, thank you all, and it was great to see you, Pat. And Pat, I expect to see you when you're here, because I don't think I have your new email address, but you have mine. And telehealth at AMCHP. So,
And,
oh, we got, oh, yes, oh, we got more cats.
Another one.
Wait,
And-
who's that?
So many kitty cats.
and thanks for being here, Linda and Jerry.
Mhm.
Our paths cross on healthcare transition too.
Wonderful. Well, it's just been lovely, and I don't usually feel energized at the end of these days, and so I actually just personally really appreciate that for you guys. So
We're glad we made you smile. Sabra, I put my email address in there for you. So
and I lovely have my Zoom set to automatically download all my chat transcripts.
there you go.
Yeah.
Oh, don't even have to.
Great.
All right, thank you guys. Have fun. Have a good
Kathleen
evening.
and Ivy and Meg, thank you very much. I totally enjoyed it. And I am just really pleased. Bethlyn, you did such a fine job pulling